here, along with my fellow physicians for National Health Program, New York Metro, in support of the invest in our New York Act. We need to fully fund all parts of health and health care.
Yep.
Housing is health.
That's right.
Education is health.
Yep.
A fully funded public health infrastructure is health.
Yep. Right.
Jobs are health. A living wage is health.
Yes.
Not cutting Medicaid is health.
Right.
Governor Cuomo proposed cutting Medicaid before the pandemic.
Right.
Then the pandemic hit. A smart, kind, wise person would realize they had made a mistake. Governor Cuomo, on the other hand, is continuing to cut Medicaid. For years, safety net hospitals have been underfunded because indigent care dollars are supposed to go to the safety net hospitals and instead are diverted to New York State only. The worst in the country, 50th out of 50 states, the indigent care dollars are diverted to the hospitals that don't need them, to the hospitals that don't take the Medicaid patients, to the hospitals that don't take the uninsured.
Yeah.
And that is why safety net hospitals around the state have been closing. And before the COVID pandemic hit, more hospitals were scheduled to close. And after the pandemic hit, a wise, kind, and smart person might have decided their policies were wrong. But instead, Cuomo is continuing to promote hospital closures. He is refusing to fix the indigent care pool. Now, we've heard already about the billionaires of New York who continue to get more and more tax cuts, which is what Cuomo promised when he ran the first time, and again the second time. And all we are asking with the Invest in Our New York Act, 6 specific bills, is to have more progressive legislation so that we can tax the people who can afford it, so that the people who can afford it will fully fund things for all New Yorkers. Improve CUNY and SUNY funding, improve pre-K through 12 public school funding, improve access to housing, don't cut Medicaid. That's why PNHPNY Metro supports the Invest in Our New York. It's bills. It's why we, of course, support and continue to support the New York Health Act, which will provide comprehensive, affordable, universal coverage for all New Yorkers, medical, dental, mental health, and long-term care, affordable for all New Yorkers. This is good for all New Yorkers, whatever your skin color, wherever you live in this state. Who's from the Campaign for New York Health?
Hey everybody, as advocates, we often get asked, how will we pay for it? How will we pay canceling rent? How will we pay for having proper ventilation in our public schools? How will we pay for health care for all? Here in the U.S., 42% of cancer patients go bankrupt within 2 years. 62% of all bankruptcies are due to medical debt. 50% of those are people with insurance. Under the current for-profit systems, we pay for it in gravestones, we pay for it in anxiety, in rationed insulin, in piles of gold teeth. We pay for it with fucking GoFundMe. We pay for it by refusing a 10-cent raise so we don't get kicked off of life-saving Medicaid. We pay for it by letting our bodies deteriorate so that we can pay rent instead. These are the disastrous consequences of continual disinvestment in public health. Austerity measures lead to body bags, outnumbering PPE, beds, and staff during a pandemic. Savings in the executive budget means closure of critical programs and hospitals, skyrocketing mental illness and death, and especially in our BIPOC and communities. Meanwhile, health insurance companies with record profits and New York billionaires get richer. The Invest in Our New York Act and the New York Health Act both create structures to redistribute wealth more equitably instead of being extracted from our most vulnerable and marginalized communities.
That means, therefore, that we need the legislature to stand up for New Yorkers. We need the Assembly. We need the Senate to demand that we pass those 6 bills, the Invest in Our New York Act. And for me, following the fact that the rent still has not been canceled, and millions of people are subject to eviction, while thousands upon thousands, 90+ thousand people across New York State are experiencing homelessness. And there are answers, there are solutions to these crises. On homelessness, the Housing Access Voucher Program costs $500 million a year to end homelessness across New York State. I'll take a huge cut out of it. And we got a tax rate to make that happen. And so I want anybody that listens to this to really understand that Governor Cuomo is not our friend. Governor Cuomo has a lot he needs to deal with on his own personality, his own life. And right now, because of the situation that we find ourselves in, not just because of COVID-19, but because of the subsequent crises across our state that have been amplified by COVID-19, we have an overdose crisis across New York State. We need universal access to medication-assisted treatment and other initiatives like safer consumption spaces, overdose prevention centers, and we need the money to fund those initiatives. And you know where we get that money from? The billionaires that collectively raised more than $77 billion since the beginning of this pandemic. So Governor Cuomo, are you going to continue to side with the oligarchs? Are you going to continue building an empire at the expense of vulnerable people? If you are a person of faith, and you understand how that does not align with what we are called to do. We are called to take care of our vulnerable people, and those people are black, they're trans, they're brown, they're experiencing homelessness, they're at risk of overdose. They're in nursing homes, they're in prisons, and don't have access to the COVID-19 vaccines. So with that I say, go forth, hold your senator, your assembly member accountable. There is no excuse. The billionaires will not leave. You know what? If they want to leave, get the fuck out.
Thank you guys for tuning in. We're in front of Cuomo's office in Manhattan to demand the stop of the cuts to Medicaid and 340B funding and to invest in our New York Act.